A little bit about the abdominal pain that you've been experiencing.
Your learning objectives for mastering the abdomen examination are to inspect for symmetry, scars, and striae, to auscultate bowel sounds, percuss the liver, and measure its span. You will perform light and deep palpation of the abdomen and palpate the liver edge. You will examine the spleen and assess costovertebral angle tenderness. You should be skilled at assessing for guarding and rebound tenderness, and be able to listen for and identify abdominal and inguinal bruits. Common or concerning symptoms relating to the abdomen and which are specific to gastrointestinal disorders include indigestion, nausea, vomiting, hematemesis, abdominal pain, dysphagia and odenophagia, change in bowel function, constipation or diarrhea, and jaundice. Common or concerning symptoms relating to the abdomen and which are specific to urinary and renal disorders include suprapubic pain, dysuria, urgency or frequency, hesitancy, decreased stream in males, polyuria or nocturia, urinary incontinence, hematuria, kidney or flank pain, and ureteral colic. Eliciting the patient's concerns before the examination makes your examination more efficient and more reassuring to the patient. Before beginning, let's review the anatomy of the abdomen. The abdominal wall extends from the rib cage above to the pelvis and inguinal ligaments below. The rectus abdominis muscles can be identified when the patient raises both head and shoulders from a supine position. Palpation is easier lateral to these muscles. For descriptive purposes, the abdomen is divided by imaginary lines that cross at the umbilicus. These lines form the right upper, right lower, and left lower quadrants. The abdomen may also be divided into 9 areas. The 3 midline areas are the epigastric, umbilical, and hypogastric or suprapubic areas. The abdominal cavity extends up under the rib cage to the dome of the diaphragm. Most of the liver and stomach, and usually all of the spleen, are within the abdominal cavity. The normal spleen is mostly posterior to the left mid-axillary line. The abdominal aorta, usually palpable in the upper abdomen, bifurcates into the common iliac arteries below the umbilicus. As the external iliac arteries pass under the inguinal ligaments, they become the femoral arteries. The intestines fill much of the abdomen. The sigmoid colon and portions of the transverse and descending colons may be palpable as tubular structures. Except for a pregnant or gravid uterus or a distended bladder, normal pelvic organs are not detectable through the abdominal wall. The kidneys lie posteriorly, partly protected by the posterior ribs. The right kidney is slightly lower than the left. To assess for kidney tenderness, locate the costovertebral angles. They are posterior to and below the 12th ribs lateral to the vertebrae. With the patient's health history in mind, and after good hand hygiene, you are ready to examine the abdomen. Before you examine the abdomen, make sure that the patient has emptied his bladder. Lower the table flat. Then, ask the patient to lie down and relax. Expose the supine patient's lower abdomen by raising the gown to below the nipple line and lowering the drape to the suprapubic level. Inspect the skin for scars, striae, dilated veins, rashes, or ecchymoses. Inspect the symmetry and contour of the abdomen. Is it flat, rounded, protuberant, or markedly concave or hollowed? Are there any bulges? Observe the contour of the umbilicus to look for signs of inflammation or hernias. Are peristalsis or aortic pulsations visible in the epigastrium? Warm your hands and your stethoscope. Listen for bowel sounds by placing the diaphragm of the stethoscope gently over each quadrant. Listen to the abdomen before performing percussion, because these maneuvers may alter the frequency of bowel sounds. Occasionally, you may hear the normal stomach growling. If the patient has high blood pressure or atherosclerotic disease, listen in the epigastrium over the aorta. Then listen over the iliac arteries and the femoral arteries.
Okay, everything sounds fine.
Next,